Everybody, it's Dr. Patmos. Today is April 23rd, and I have an important video for you today about some outrageous action that Dr. Jay Bhattacharya, the acting director of the CDC, just took. It's in the link. It's linked in the text below, so be sure to look at that. In a very nice piece written by Apurva Mandavili of the New York Times this morning, it was described in great detail how and why Dr. Jay Bhattacharya, the acting CDC director, has unilaterally and arbitrarily blocked CDC from publishing research. The research that is being blocked is proof from a very well done, well executed study, case comparison study, using the same methodology that we've used for decades all around the world to assess vaccine effectiveness. Dr. Bhattacharya now decides, in his absolute authority, that that research methodology is no good. So he's blocking the study. What did the study show? It showed that the CDC, that the mRNA COVID vaccine is highly likely to save your life. And the CDC, according to Bhattacharya, doesn't want you as doctors or healthcare providers or even the public to know that the COVID mRNA vaccine is highly likely to save your life. Now, what is Dr. Bhattacharya's qualifications to say this? Who is he? What makes him smarter and more knowledgeable and experienced in this than all of the scientists at CDC and all the other infectious disease doctors out there? The answer? Nothing. And this is the part of the story that never gets told, that I think is the most important part of the study. Anytime one of these doctors in the administration comes out and says something, first thing I do is go look at their resume. That's what the reporter should do too. Pull the resume first and see whether or not this person has any credentials or experience or education at all to be talking about what they're talking about. So since the media hasn't done this, I will. Let's review Dr. Bhattacharya's resume. I have. I've studied it for years. It's on my desktop. I've gone over it line by line and I fact checked it. So let me tell you what is in and what is not in Dr. J. Bhattacharya's CV. Yes, he is a doctor. He graduated from Stanford Medical School with an MD degree. Whoop-de-doo. That is an entry level credential that qualifies you for nothing. It's an ornamental degree. It's worthless unless you do graduate medical education. What physicians do when they graduate medical school is they do an internship, then they do a residency, and they may or may not do a fellowship. Then they take a test, and they become board certified. Then they're a real doctor. Bhattacharya never did an internship, never did a residency, never did a fellowship, is not board eligible, and is not board certified. For those reasons, he doesn't even qualify for a license. He can't even be a licensed MD. He doesn't meet the minimum qualifications to even qualify for an MD license. He has no patient care or clinical experience at all. He has no hospital privileges, doesn't qualify for medical staff membership or clinical privileges. He's never seen a patient. Since graduating medical school, he's never seen a patient. So he has no experience in the real world of bedside medicine. He doesn't take care of sick people. He doesn't know what COVID looks like. He's never seen a case of it or managed a patient with COVID. So that's on the clinic. He has no clinical credibility whatsoever. Now you might say, well, that's not important for this role. He must have research credibility. No, he doesn't. His PhD is in economics. He falsely claims to be an epidemiologist. He is not. He does not hold any degree in epidemiology. He doesn't have a master's in public health. He is an economist. And he has no training in clinical research, laboratory research, molecular biology, immunology, microbiology, infectious diseases, and epidemiology. He's never worked in a laboratory doing basic bench research. He has no experience doing clinical research in vaccines or vaccine effectiveness. He's not published anything on vaccine effectiveness other than his famous, infamous piece of crap called the Great Barrington Declaration. So, if for those of you, I'm sure you've heard of it, but if you haven't read it, you need to read it. The Great Barrington Declaration, of which Jay Bhattacharya is the lead author, makes all of these recommendations about how we should handle the COVID pandemic. Except there's only one problem. Scroll down to the end of the paper. It has no bibliography. There are no references. The recommendations of the Great Barrington Declaration are not based on any established facts published in the medical literature. Dr. Bhattacharya made them up. And where did he make them up? Apparently, he made them up sitting in the Oval Office. Why do I say that? Because there's a photograph documenting exactly that. There's a photograph published by Dr. Scott Atlas where he talks about the meeting with the president to discuss the COVID situation. And in the room happened to be the authors of the Great Barrington Declaration. So here we have a doctor who, and oh, by the way, did you ever go to sixth grade? Do you remember sixth grade science? Have you had any children or grandchildren that have gone through the sixth grade? You might remember that when you write a paper, a scientific paper, there's this thing called a bibliography. You know, where you're supposed to put references that support your conclusion and recommendations in the paper. Well, guess what the Great Barrington Declaration doesn't have? No bibliography, no references, no footnotes, nothing to support its recommendations. Bhattacharya just made them up. And the sad thing is that the Great Barrington Declaration is what now informs our management of COVID. You know, the idea that we're only supposed to vaccinate the elderly and the chronically ill, and the other people, we should just let them get COVID, you know, let her rip. We want them infected because they're at no risk. Well, that's not based on any research. That's a thing that Bhattacharya made up. And by the way, it's not true because about 20 to 30% of all the people who died of COVID, the 1.2 million people who died of COVID, were in the low risk group. So, yes, children do die of COVID. Young, healthy people do die of COVID. I know, I've seen it. Not only elderly and chronically ill. So, this notion of targeted risk-based vaccination that Bhattacharya came up with is not based on any data. It's based upon his idea. It was what he came up with sitting in the Oval Office with Donald Trump. Anyhow, that's who's now running CDC, and that's who's now decided that you, doctor, shouldn't know that the COVID mRNA vaccine saves lives. It is Dr. Bhattacharya, the economist, the Trumpian obsequious sycophant economist who doesn't want you, the public, to know that the CDC, that the COVID mRNA vaccine works, and it works really well to do its primary goal, which is to keep you alive, to stop you from dying or ending up in ICU on a ventilator for a month. So this is very important because this is, you talk about censorship and suppression. This is clearly censorship and suppression of important, vital information that the public has an absolute right to know and that the government has a duty to divulge. And Dr. Jay Bhattacharya, in his own omnipotent and unqualified position, decides unilaterally that this quality research done by highly trained scientists, vetted and peer reviewed by highly trained scientists, doesn't deserve the light of day, and that you don't deserve to know this. They want to perpetuate the false information that these vaccines are somehow dangerous and ineffective. That is false. This study proved it. These vaccines work well. And now, unfortunately, you don't get to know that because an unqualified doctor who falsely claims to be an epidemiologist and has no research experience in vaccine effectiveness just decided that you don't deserve to know this. This is an outrage. He should be fired immediately.